welcome back to my channel. As you can see by the title of today's video, I'm going to be talking about coping after your first code blue. So just to preface first, I don't know if you guys can tell, but I'm not really wearing any makeup. I'm kind of in some comfy clothes. I even have a cup of tea here with me. And that is because this is obviously kind of a sensitive topic for some people, but a lot of my videos, I want to come to you guys professional. I am made up. I'm very organized. Same time, this is one of those topics where I feel like I just kind of almost want to be like a best friend for you, or that person who's gone through a situation that you come to talk to and just say, hey, how did you handle it? And just make it almost seem like we're just friends in a comfy environment. It's a safe place to talk about. So with that all being said, I want to kind of break this video up into a couple parts. The first one is just talking about a code blue in general and kind of like the types of codes that we have, how we are supposed to respond to it. Obviously, it does change just a little bit depending on where you're at and with policies and things like that. But for the most part, the way we respond as registered nurses will be the same. And then talk a little bit about some of the typical feelings and things I've seen my coworkers experience afterwards, which could be anxiety, it could be regret, it could be unpreparedness, it could be, you know, that they actually felt energized and felt bad for being energized and enjoying an adrenaline rush. Talk through some of those scenarios and then also follow up with one or two of my personal experiences, how I handled it, and then kind of end with just some generalized tips for you guys on coping, whether you're a student or a new graduate nurse, or you've been a nurse for a while and maybe you just had your first code and you've been a nurse for a couple years. That's kind of how I want to lay out this video. Now, if you guys want to have a video that's more of a how to respond in a code situation, just leave a comment below. I can work on that if that's something you'd find helpful. But for this video, I'm just going to limit it to how to cope with it. Okay, so let's talk about codes in general first. There are typically two types of codes when working with adult patients. The first one is a cardiac arrest when the heart stops beating, and the second one is an airway code when someone stops breathing, and a lot of times they will happen together. So basically, for those of you who don't know, and I didn't know before I became a nurse, and it's okay, I had to be the person that asked the stupid questions. A heart attack and cardiac arrest aren't the same thing. A heart attack is when someone's like actively having damage to their heart because of a blocked vessel or a high stress situation, and they're having that chest pain. You think of your classic heart attack symptoms. Somebody may have to go get a stent placed, go to the hospital for it. Whereas cardiac arrest is when the heart stops beating. And you may see somebody go into multiple different rhythms. It's not just asystole, which is where the heart stops beating completely and you see that flat line like you do on TVs. They could be having an arrhythmia. So something like ventricular tachycardia is basically when the ventricles of the heart are just basically like the ventricles are contracting too fast to really get anything done. Whereas ventricular fibrillation, and I'll put rhythms for each one on the video, is where the ventricles are just quivering. The ventricles are the chambers at the bottom of the heart. There's a couple of other different arrhythmias which I won't get into, but that is basically what a cardiac arrest is like. Whereas an airway code is when somebody maybe has anaphylaxis and their throat swells up and they can't breathe, or they just stop breathing for a different reason. Maybe they had brain damage. Maybe their heart stopped beating first and then they stopped breathing, or maybe they just couldn't maintain their airway, they stopped breathing, and then they go into cardiac arrest. It's a couple different ways, but the responses to both are very similar. Obviously, if you have an airway code, you're gonna have an anesthesiologist and a respiratory therapist in the room, and they're gonna help reestablish an airway, maybe hook up the patient to a ventilator. Whereas with the cardiac arrest, which is where a lot more of the nurse role comes in, and that's when we swing in that code card. Somebody starts compressions first. Your buddies are hooking up paddles and patches It's usually just patches, not paddles anymore, like the TV shows still like to show for some reason. To shock a patient depending on what rhythm they're in. We've got medications in the cart to give based off of what kind of rhythm they're in. If they're in asystole, if we need to give an antiarrhythmic, if we need to give bicarbonate because maybe the reason they're having cardiac arrest is because their electrolytes are imbalanced. So we start to pull out all those tools and think as nurses, what could be going wrong. Maybe you've heard of H's and T's, which are a list as well, reasons for someone to go into a code. So all that being said, those are kind of some, to give you an idea of what a code would be like, those are some of the reasons why we would have to code someone. Now I'm going to kind of talk about it in the sense of as if you've seen a code before, you have a little bit more knowledge base about codes. Like I said before, I've had coworkers, and myself included, a lot of the parts that are hard to cope with is obviously during a code, either your patient's going to survive or they're not going to survive. And sometimes if they survive the code, if they're older, if they have poor health to begin with, it can be really hard to see a patient just suffer poor, low quality life after a code and either die eventually or just almost turn into like a vegetable basically. So those are some possible scenarios. Obviously, the best outcome is when you've coded someone and you've gotten your ROSC back and they survive and they do well and they recover. And then the worst case scenario is when they pass. I've been in each one of those situations. I worked in a cardiovascular ICU as my first job, both as a PCA and as a nurse. And so we saw codes, I would say at least a couple per month. Between our unit and the neurotrauma unit right next to us. And I think the first time I was present for a code, I was obviously terrified. Even though it wasn't my patient, in the back of my mind, I was like, if this was my patient, I would totally be freaking out. But I do have to be honest and say, if somebody else's patient was coding, I felt very clear-minded. I was ready to help. The algorithms came right to me. I was kind of like, let's go. I'm having my adrenaline rush and I feel pretty hype about it. I kind of like having that adrenaline rush, having to think. I don't like the fact that somebody's not doing well, but I like, for some reason, the adrenaline rush of I'm about to put my top skills to the test to save a life and do my best attempts to it. And there's something rewarding that comes with that, especially after you've saved a life, but in the moment, you just think quick. Whereas if it was my patient who was coding or coming close to coding, I felt like a deer in the headlights. I'd freeze. I didn't know what the first thing to do was. So in that kind of situation, one of the first ways you can cope is make sure you've got great teammates. Like when you go into a job for the first time, you better make sure that the people that you're working with, your coworkers, have your back, are not going to squabble over stupid things, and they're just going to get right to it. And you know, if you aren't in the right mindset to assign people roles, that people just pick up a role that they know that they're comfortable with, or you know, maybe that somebody else hasn't picked up, and help you. So that's tip number one, is make sure you're communicating with your coworkers and finding a great work family, because that makes coping so much easier. The second thing is, it is okay to know that when you're the one with the patient who's coding, it is oftentimes, it's not just you who's gonna feel like a deer in the headlights. I guarantee you, your coworkers feel like that when you're assisting them, versus when you're assisting a coworker and you're like, yeah, I've got your back, I know what to do, let's go. It's different, and that's okay. Another thing I experienced, as well as my coworkers, with my coworkers, was anxiety. Sometimes you come to work and you'd wonder, is someone gonna code today? Am I gonna remember what to do? Am I gonna perform well? Is there anything that I've possibly done that led to the code? Like, did I miss something that led this person to coding and dying? Like, you know, I go home and think about it, and that is a normal part of nursing, but it's not normal when it happens consistently and you're not learning how to cope with it, if that makes sense. So all of that to say, make sure after a code you're talking to your coworkers about it. I do feel like there are some people that I worked with who acted very stoic and who were very jaded. And if it was my patient, I could get very emotional about it and very nervous. Like in the nursing field, we don't talk about the code after it's happened enough. Even if it's everybody's getting ready to go home for their shift, sometimes you can't talk about it right away. You just got to keep working. People have to go back and check on their patients. But at the end of the shift, we do a very poor job of actually wrapping up and kind of talking about how did that go? What could we have done better? And that was always a huge anxiety reliever for me, to hear other people's voice. I could have done this better. I could have helped more there. We could have done this instead. And it wasn't just oh, that was my fault that this happened. That was my fault that we didn't make this work, or that person performed a certain way. But then people would sometimes share like, hey, you did a good job. I'm sorry that this was the night that you had. You performed well, and just getting that positive feedback from other people and also giving it to people is very helpful. So quick little story time before I kind of wrap up with the tips is I remember 2 instances. The good thing is I have had to be a part of an airway code for one of my patients. And then I also had a patient where we brought in a code cart and we gave antiarrhythmics, we put on patches, we paced the patient, but we never got to the point where we had to do compressions on them. But I have helped other people code and go through the whole thing, from compressions to getting them back, to having to shock a patient, to having to do the whole thing all over again. Bringing the code cart into my patient's room and setting up patches was very anxiety inducing. Again, I felt kind of that deer in the headlights, and I think in that moment I've grown, but I've learned to just, in my own time when I was sitting at the desk and nothing was happening, just close my eyes and run through really quick, what would I do first? If this was happening, if bradycardia was happening, what would I do first? If ventricular tachycardia was happening, what would I do first? And usually if you give yourself a chance to think through the first 3 things that you would do, including calling out for help and pressing the code blue button and starting compressions if it's appropriate, your buddies will kind of swoop in and help you do the rest. The first couple code situations, but I just remember sitting there thinking, what have I done to contribute to this? Even though I didn't do anything, the patient had very poor health history, needed dialysis. Dialysis was getting delayed. Was doing my best to advocate for it. It was in the middle of the night, so of course that was harder to do. And then in the other instance, it was kind of did the patient really need an airway? And when I look back, I'm like, yes, we did all the right things. I called the doctor at the right time. He made the right call. I painted the picture correctly for the doctor, because I was like, does this person really need an airway established, or was I painting the wrong picture for the provider? But again, I had my charge nurse kind of there to help say like, no, you're doing the right thing. You're advocating for the right thing. Sometimes the doctor on the phone was a little bit scary to talk to. That made it really hard to, convey what was going on accurately, but I just had those voices around me that were positive, saying like, yes, you're doing the right thing. And then obviously helping other people and watching them have the deer in the headlights moment almost comforted me, knowing that I wasn't the only one that sometimes freezes, but you do have to learn how to get through it. I do kind of feel like I'm beginning to ramble a little bit, so I just want to wrap up with, here's some ways to cope. The first one is make sure you really do talk to your friends afterwards and have that little meeting and say, hey, go to your charge nurse and say, hey, what could have I done better? What could we have done better as a team? Is there anything that we can do the next go around that would make it easier to access the things we need, or call the provider? I want to learn what each of my teammates is most comfortable with. Some people were really good at scribing, so I'd make sure that they were scribing. Other people were really strong and good at compressions. Somebody else may have been really good with like giving medications and just knowing all the doses off the top of their head. Somebody else may be like, I'm very comfortable shocking a person, you know, and reading the rhythms, and kind of figuring that out from your coworkers is helpful. Don't be afraid to change your role anytime there's a code so that you do get comfortable with it. I was very comfortable with scribing, and I was comfortable with like getting the code cart and setting out the patches, but I wasn't as comfortable giving the medications. And I wasn't as comfortable like remembering the algorithms. So each time there was a code, I tried to jump in at a different area so that I got more comfortable with it, and learned each role effectively so that I could be of help. I think the third thing is to make sure that you talk to someone you love about it. So like a family member or friend that you trust, obviously keeping HIPAA in mind, but sometimes we do have to talk out the scenario, and it's almost like a form of therapy to help you feel better and just kind of talk out loud through what happened. Sometimes we bottle it up and we do get jaded and we're like, we've seen this all the time. You know, I don't want to go tell my husband about another code that happened because he's not going to care. Well, it turns out he does care. And most of us have someone that we love who does care. And it's helpful. You know, it's helpful to get your coworkers' perspective, but it's also helpful to just, you know, let it flow out to somebody without receiving feedback, but just receiving like, hey, I'm here for you. I'm sorry that happened. You know, what can I do to help you, kind of feedback, if that makes sense. Another thing is, let's say your patient is passing or has passed due to the code. Sometimes interacting with family can be very nerve-wracking. Sometimes it can go different ways. Some family will act and blame you for it, even though it wasn't anywhere near your fault. Some family will be very super appreciative and be like, thank you so much, you know, you did your best, we saw it, and just be super appreciative. And some people will be somewhere in the middle where they're, you know, more into the grieving process, like the beginning of the grieving process. And I think a lot of people, there's almost a stigma that like you can't cry after someone's passed, and this kind of gets in a little end of life care stuff too, but and I think the one thing that I usually share with people that I precept or students is it is okay to cry. I think the most connection I've had with patient family members is when I've cried and embraced them. The biggest thing is you just have to do it professionally. If crying is taking you away from the work that still has to be done and the compassion that still has to be given, then it's not appropriate at that time, and you need to step away and have a moment and have somebody else like your charge nurse come in and help you in that moment. If you're able to do it in a way that you can still interact with patient family members and take care of the patient, you know, no matter what stage they're in at that point, then I think that that is appropriate. If I'm going to talk about my grandpa, when my grandpa passed, this is before I was even in nursing school, the nurse that was there with us cried, you know, gave us hugs and shared, you know, just small interactions that she had had with my granddad about like, you know, how he did something that made her laugh, or she could see his love for his family during his stay there, and that was touching to her. And having an interaction like that was appropriate, professional, and made us just feel a little bit more comforted in a small way. But the nurse's tears didn't get in the way of her job. And so if that's the way it's displayed, I think that that's appropriate. Other people may feel differently, but that is a way to cope, is to be there with family and learn how to be comfortable with patient and family members and just be there for them. And then I think last but not least would just be educating yourself, you know, on kind of like to go along with the different roles, you know, just make sure you're always up to date on algorithms and educated on the medications and why they would be given, and cardiac rhythms, and just knowing that and having it in the back of your head, I think does help decrease some anxiety when Obviously, experience is the best way to learn, but if you can read and teach yourself and just keep up to date on BLS or ACLS or PALS, then it is helpful in reducing anxiety. I hope that this video was helpful for you guys. If there's anything that you want to share about your first code potentially, or ways that you've learned to cope, please share it below. I feel like this doesn't get talked about enough. I'd love to make more videos like this, and hope that I was able to convey what I wanted to convey in this video. But if you guys have experience, there's plenty of you guys who watch me that have more experience than I do and great things to share. Just drop it down below so we can keep it a safe space and just a community that builds each other and doesn't allow fear and anxiety to keep us from a job that we love doing. I hope you guys enjoyed it, and I hope that you'll tune into the next video, and thank you for watching me. If you did like it, don't forget to hit that like button and subscribe to my channel so that I can keep making content for you guys. I love you all, and I'm here for you. As I always say, see you later. Tutuanana.